Hi, I'm Dr. Romina Lee, and I'm the Chief Resident of the Family Medicine Residency Program, and I'm really excited to show you why I love CHI.
Welcome to CHI, and welcome to the Brodes H. Hartley Teaching Health Center. You have chosen to come to a center of excellence.
For a program to really be great, several things must happen. Number one, they have to have faculty that is very committed and really good at teaching. They have to have leadership that is committed to ensuring that this program is sustainable. There has to be a program where the residents will have a wide breadth of exposure experience. And we provide all that in CHI. We think that we have all of the required elements to really make it exceptional.
When I was looking for a residency program, I wanted to find something that was a little bit smaller, where I felt like I could ask questions. If I wanted to make a suggestion, I could make a suggestion without feeling intimidated. CHI is great. It's a smaller program, but you also have the vast diversity of the patient population. So you see a lot of patients, you learn a lot. It's allowed me to really grow as a doctor.
It's a place where the leadership and the faculty have a passion for teaching.
I think we have an amazing staff, program director, Dr. Philippe. She's amazing. She's like a mother to us because we're a very small program. She's very approachable, which is all our staff. So you get that one-on-one. So any questions you have coming up, you ask the attending right away. That really reinforces the knowledge that you get from the books that you already have from med school. But now in the clinic, you're seeing the volume that's representing the theory that you learned.
The Teaching Health Center has two very strong programs, and both work together with a comprehensive approach to care.
They also get to participate in interdisciplinary case conferences where we take patients with multiple comorbidities, primary care issues, behavioral health issues, dental issues, discussing those with the right people, nutritionists, care coordinators, trained faculty.
Dr. Elizabeth Philippe is the Associate Director of Medical Education and the Program Director for Family Medicine.
Our residents get a good experience in a vast array of medical problems. You can be treating malaria, which is very common in the Caribbean and South America. You can be treating tropical diseases and become very good at it.
Training also includes research projects. Some have even presented those projects at national conferences.
Our residents look at high-impact processes where with outcomes that can be very detrimental to patient care. For instance, we look at processes related to abnormal mammogram. We look at processes related to missed appointment, processes related to abnormal PAP.
A strong faculty is also heading up the psychiatry program. Dr. Moises Riverone is Associate Program Director for Psychiatry.
Right now we have 3 board-certified child and adolescent psychiatrists, which is huge. That's hard to come by. Our faculty members are usually in-house. We have an open door policy. We're not very busy with patient care, which allows us to have that one-on-one time for the residents, which is huge, especially during the 4 years of residency, which can be a little stressful.
Residents at CHI can expect to have some unique experiences, such as practicing in the adult crisis unit.
This does not exist in any other teaching health center to my knowledge. We have an inpatient unit where the residents spend a lot of the time managing crises with a wide variety of acute patients.
And soon, they will be able to practice in the new state-of-the-art Children's Crisis Unit, slated to open in 2021. They will participate in community outreach and work in CHI's mobile medical van that goes to local public housing complexes and treats the homeless. Here, at CHI's Teaching Health Center Clinic, you will see a variety of patients.
Is that normal for you?
And your training also takes place in the hospital setting at locations such as Jackson, Maine, Jackson South, and Larkin Hospital.
Rotating through those hospitals gives us a different perspective and how the hospitals work versus here at community health center. So I do like traveling from one hospital to another hospital because it gives me sort of the background that I will need once I go into my own practice and decide to work at different hospitals.
Right now, this is the hub of the Teaching Health Center, our offices, and also a classroom. But The future holds much more as there are big plans.
We see our ability to expand, bringing in more residents and more faculty. Our CEO is actually looking into us building a separate independent educational facility with an amphitheater, with accommodations, with play areas, with study rooms, with a library for the residents. So when they're with us, they don't have to worry about accommodation and where they can have their didactics.
We can provide affordable housing for these residents and their families while they're going to go into residency training. That will be a plus for us.
And as more and more residents graduate from the Brodes H. Hartley Junior Teaching Health Center program and go on to prestigious positions, the achievements continue.
We used to be an osteopathic program. We're now accredited by the ACGME, the Accreditation Council for Graduate Medical Education, that allows us now to also train MGs, and that has also brought in a wide variety of applicants. We also have residents who want to stay with us. We actually are becoming so competitive now that we have to begin to decide on who we can keep, because we can't keep everyone.
It's a program where residents have had great success passing their boards.
When people ask me, how's my experience at CHI, I always say it's a gem. The faculty has really been fantastic.
They're all different residencies, and each and every one of them teaches us like a pearl that I will take on to when I become an attending in July.
If you want to do community medicine, I think this is one of the best programs for you.
Thank you so much for coming and for joining me on this virtual tour. I really hope that you understand now why I chose CHI and why it's such a special program. I really do hope that you come to CHI, and if you have any questions or you need anything, please feel free to reach out and we'll be happy to answer any questions.